One of the biggest risks of vasectomy, other than these talking about some of the surgical complications and things, is that of vasectomy regret. And this is something that is real. It's often quoted as a rate of about 5%. I've seen it as high as 10 to 20%. My name's Dr. Joseph Harryhill. I'm Clinical Associate Professor of Urology at the University of Pennsylvania, working primarily out of Penn Presbyterian Medical Center. I have experience with vasectomies, have done them for years, both in the office and the operating room, so I have some experience with the procedure and its potential after effects. Technically speaking, the procedure involves interruption of the vas deferens, which is the tubes that carry the sperm. You have one on each side, both testicles, and so when the procedure is done, it involves a small incision in the scrotum on either side, where we bring it up. I do what's called a no-scalpel vasectomy, and you remove or take out a small section of the vas deferens to prevent sperm from going through and mixing with the semen that comes out. So when you remove that section of the vas deferens, after about 6 to 8 weeks, there will be no viable sperm in the fluid that comes out in the semen. What's most important to tell a man or a couple who is seeking vasectomy is that they really understand that although in the future it potentially could be reversed, the procedure is really done in a way that's a permanent form of sterilization. They have to be comfortable with that. They have to understand that. And, sometimes people will come in and say, well, it can be reversed later on, right? Or maybe I can bank some sperm or something like that. And you have to really stress the importance that they understand that it is done in a permanent way. We actually remove a section of the vas deferens to keep those ends from coming back together. Some risks right after the procedure would be, bruising or bleeding, which is not that common but can occur. And obviously there's going to be discomfort that will last typically several days. And during that time, the men are instructed to really reduce their activity with work and exercise. The mistake is that you feel fine, and then the next day you go to work, or you're on your feet all day long or something, and you can have a lot of swelling afterwards that will delay the healing process. There can also be a risk of infection, but fortunately that risk is very low. When you're operating, there are blood vessels that are near there that you have to be very careful about trying to avoid or cauterize them when you see them. So someone could get bleeding of a significant degree. You could get like a big hematoma in the scrotum from a scrotal operation. If someone is maybe taking aspirin or another type of blood thinner, and maybe they forget to stop taking that, you could have a significant amount of bleeding as well. And sometimes that will delay the healing process and occasionally even necessitate a return to the operating room for some other type of procedure. You can get swelling like a spermatocele or hydrocele in rare cases, and some men will develop what's called a sperm granuloma, which is a painful little knot that occurs when sperm leaks out from the cut end of the vas, and when it goes into the tissue surrounding that area, the body reacts to it with an immune response, and you get like a little inflammation that's there that can be quite tender for some time. And I guess another risk you could consider is that pregnancy could still occur after vasectomy. I quote a statistic usually of about maybe 1 in 5,000 with my patients that they could have a pregnancy after vasectomy. Also, something that has been very controversial over the years that we still have debates about. And I should point out that there were epidemiologic studies that were done probably 20 years ago or more about whether vasectomy may later increase a man's risk of getting prostate cancer. Some of the other ones were probably discounted, like an increased risk of heart disease, etc. But this is the one that keeps coming up from time to time. After this was done, there was an epidemiologic study at Harvard that was published many years ago. I remember it. And then the AUA convened a blue ribbon panel to look at the studies and sort of did a meta-analysis of all the valid studies to show that they didn't really see that statistical association between vasectomy and prostate cancer, but it remains something that that patients will occasionally ask about, and we're not really sure, what those long-term effects could be. Maybe there is some immunologic event that occurs with vasectomy that could change your risk of cancer later on. But there's such a long time frame between the procedure and maybe something like that happening that it's difficult to connect those dots. Patients need to know that there is a risk of chronic pain. It is maybe 1 to 2%, but this is a group of men that may have testicular pain that lasts more than a few weeks or even months. So 1 to 2% may not seem like a lot of someone getting chronic pain, but when you consider that hundreds of thousands of men per year have this procedure, it adds up. The thing that really sticks out the most when you consider these possible long-term complications is the issue of chronic pain, what we call orchialgia, testicular pain, and how sometimes it can really have a significant impact on a man's health and well-being. For example, I just saw a patient back for a follow-up in clinic. He's in his mid-30s. He underwent vasectomy probably more than a year ago. I think it has been close to a year and a half since his vasectomy, and he came to see me for a second opinion after this pain continued after the first period of time. I went back to his urologist a couple of times, and he kind of wrote it off and said, well, everything's normal on exam and it should get better. And when I saw him as a second opinion, I went through to find out what could have happened. He described during the procedure he had this severe jolt of pain when something was being clamped on one side, the left side, and he continues to have pain on that left side. To this day, it has been continuous. And at first, the pain was so bad that he was actually unable to work, and it was a bad situation for him. He's a divorced man who has custody of his children, and he's trying to take care of the kids, and he was in such pain he had trouble working and managing the home, and so the guy was really in a bad way. We've made some headway with his treatments. We've tried different medications. I've actually done an injection with maybe a modest improvement in his situation. But it's frustrating because things look normal on examination and on ultrasound. So this is a challenging thing to treat. Perhaps there's damage to a sensory nerve that occurs in that area, and that's very difficult to identify and to be able to treat effectively. I always caution people, when you look at those statistics, it's like, you only have a 1% chance of this happening, and that's of little consolation to the guy who's in that 1%. To be able to identify exactly where that pain is coming from is a challenge. You're using medications that potentially will have side effects, and drowsiness, different things, and they don't work as well as you might hope they would. I've tried different injections. There's even been some use of procedures where you go in and try to try to cut the nerve that is causing the pain, or somehow ablate or destroy that nerve. And it's very tricky because these are very small structures. What's often quoted may be around 5% of men will regret their vasectomy. I've seen it as high as maybe 10 to 20% of men who regret their vasectomy at some point, either right afterwards or perhaps later on, because maybe their situation changes. This is something that could be transient. Certain things happen in life that we cannot predict. Maybe a divorce, or heaven forbid, the death of a child or something that will that confront us and make us think of, gosh, I wish I hadn't done that. If a man chooses to have it reversed, vasectomy reversal involves basically putting the two cut ends of the vas back together. Normally the procedure, it's a very meticulous procedure that is done under an operating microscope. So you need a highly skilled surgeon to be able to do that. So technically what you have to do is there's going to be scar tissue at the end of those tubes. So you have to actually cut the scar tissue to get two fresh ends that are hopefully around the same diameter that you can bring together. And what the surgeon does is, when you cut the end of the vas that is closest to the testicle, you then can get fluid to come out of there, and the surgeon will look under the microscope to make sure that there is sperm that comes through the tube. And if there is, then they go ahead and connect it to the inguinal side of the vas deferens, and it's done usually in one or two layers using a very, very fine suture. The suture is actually finer than the human hair, so that's why as good as your eyesight might be, it's done under the microscope to get a good alignment of those two tubes. If, however, you find no sperm in that fluid, that could mean that there's been damage to the epididymis or obstruction of the epididymis from pressure after the vasectomy occurred. And so then the vas has to be connected almost directly to the testicle itself in order for sperm to come through that tube. That's called a vasoepididymostomy, where you have to connect the vas deferens to the epididymis. And that's a much more technically challenging operation to do because of the difference in the diameter of the tubes, and it's a very, very thin-walled tube, the epididymis, and as a result, the success rate when you're required to do a vasoepididymostomy is going to be lower than just connecting the two ends of the vas back together, which is a relatively straightforward thing to do under the microscope. I guess the good news is that if it's been less than 10 years, with advances in surgical technique, the success rate, as defined as having sperm in the fluid again, is as high as maybe 80 to 90%. If it's longer, as I mentioned, 15 to 20 years, the success rate would be lower. However, when you look at the actual pregnancy rate following vasectomy reversal, that's going to be significantly less. The amount of sperm may be low. There may be poor motility of that sperm, maybe because of those antibodies that we talked about. And there may be female factors as well that reduce fertility for a couple, so that the actual pregnancy rate following vasectomy reversal varies widely. You might quote as low as 30% success, or as high as maybe optimistically 50 to 60% of couples who undergo a vasectomy reversal will have a successful pregnancy brought to term. And as I mentioned, during the surgery, you have to look under the microscope at that fluid to make sure that there is sperm there. And then if you have to do the vasoepididymostomy procedure, which requires a great deal of expertise, the success rate is obviously much lower. What's very unique about sperm is that it is, inside the genital tract, and it is literally sort of insulated from the immune system, and it's a very unique kind of thing, and it was amazing to me when I first learned this in medical school that the body recognizes proteins on the sperm as being foreign, and so if it's out and about in the body and not confined to the genital tract, the body will react to it, and there will be an immune response to sperm the body sees it as something foreign, and there's various reasons for that. But the implication is that if the sperm gets out and the body reacts to it, that there may actually be in your system antibodies to sperm. And just like anything else that you get vaccinated to, or if you're exposed to a virus or something like that, you get antibodies to it, and this happens in the same way to sperm. There are studies in the fertility literature indicate that if a person has sperm antibodies, that might increase their risk of infertility. That came about when you look at men who have testicular injuries or testicular torsion that occurs, and how those men may develop sperm antibodies that will later affect fertility. It's a bit off topic, but it's kind of an interesting aspect of our immune system. Yeah, that's one of the biggest hurdles, I think, and a disincentive to have a vasectomy reversal is that most health insurance doesn't cover it. And given that that's the case, it was different when I was in the military. Men would come in. I did a lot of vasectomy reversals. And then when I moved to civilian practice, all of a sudden, there was nobody there. There was very few patients that would come in asking for vasectomy reversal because of that cost. And it may range out of pocket an average of $8,000 to maybe $15,000, and some practices, a highly specialized practice in New York City, they might charge you as much as $70,000. Considering that there's a surgeon's fee, there's an anesthesia fee, a facility fee, so it's a pretty big cost actually for the average couple to do that. Patients need to make informed decisions. They need to understand the permanent nature of vasectomy and the potential after effects, rare but sometimes serious. And they really should be informed about other alternatives. I have to admit I'm sometimes remiss in this regard, and in a big university hospital, a very secular facility like the one I work in, other alternatives are not often discussed when this topic comes up in a patient encounter, such as natural family planning, and that's something that should change, and medical students should be educated more about these alternatives when they go into their practice.